In this video, we look at Key Area 4 antenatal and postnatal screening techniques from Unit 2, Physiology and Health section. We'll look at the use of antenatal screening techniques during pregnancy first. We'll be able to know the difference between dating and anomaly scanning, which are both parts of the ultrasound scanning technique, and roughly when they would take place. We'll look at biochemical tests and when they're used and why they're used. We'll look at amniocentesis and chorionic villi sampling, the advantages and disadvantages of both, and look at some case studies on antenatal care. So why do you think it's important to screen a fetus during pregnancy? How do we think? Okay. So screening a fetus during pregnancy allows you to judge roughly when the baby will be due to be born. It will tell you if there's any abnormalities in the embryo or baby, and some of these can be treated and some of these are not compatible with life, so this is useful to know in advance. And if the child is likely to have lifelong difficulties, parents sometimes need time to prepare for these changes, so it's good to know earlier rather than later. Methods of antenatal screening can be the ultrasound imaging, so we have anomaly and dating scans. We also use biochemical tests and diagnostic testing. These biochemical tests can be through urine or blood samples, and diagnostic testing, again, can be through amniocentesis and chorionic villi sampling. We start with ultrasound imaging, where sound waves are used to get a nice picture inside the uterus. There's two scans, there's the dating and the anomaly scan. What do you think the purpose is, just looking at the word dating and the word anomaly? So the dating scan, it determines the pregnancy stage and the rough due date. There's certain points in the pregnancy that this is most accurate. So the dating scan would tend to happen between weeks 8 and 14. It will tell you roughly when the baby is due. An anomaly scan will tell you if there's anything not quite right about the baby, any physical abnormalities in the fetus. It takes place between around the 18 and 20 week mark. Blood and urine tests can also be used alongside the anomaly scan. So routine blood and urine tests are carried out through pregnancy to monitor the concentrations of marker chemicals. So HCG is a chemical that we use for pregnancy testing, but there's certain chromosomal abnormalities that give you a high HCG at certain points of pregnancy. This will allow doctors to make a rough diagnosis and maybe suggest something called amniocentesis might be carried out to do further investigations. Measuring a chemical at the wrong time could lead to what's called a false positive result. This is something that in your notes you need to make a note on, but I'll show you a slide later on for that. Atypical, so a not quite right chemical concentration, could help the doctors diagnose a fetus with a medical condition. Antenatal screening is done before birth, just to clarify that, and it's carried out to monitor the health of a pregnant woman and the fetus. Identifies the risks of a disorder, and further tests can be carried out and a prenatal diagnosis given. So we'll talk through this already. And this is a nice picture of an ultrasound. This is, I think this is an fMRI of a baby. So biochemical testing. So this is carried out along with the anomaly scan to give you an idea of what's going on. So biochemical tests can be used to detect changes in hormonal concentration. So as I said, HCG, human chorionic gonadotrophin, can detect in the blood and the urine following the implantation of the embryo. This is what we use, something called an ELISA test, to detect for pregnancy. So you can see somewhere between the months 1 and 3 of pregnancy, we get this big peak in HCG. So if you were to do a pregnancy test early on, these early pregnancy tests, for a variety of reasons, aren't a great idea. One of them is that your HCG will be quite low and inconsistent at that stage, and later on the HCG tends to drop quite a lot as well. Biochemical tests. So pregnancy is associated with normal changes physiologically in the woman's body to help the fetus survive, as well as prepare for labour. So need to know what normally happens to detect any problems. So a woman's blood pressure, so checking for something called high blood pressure, hypertension. We test a woman's blood sugar for what's called gestational diabetes. So we will look at diabetes in a later part of the course. we go into a reasonable amount of detail, you can get a form of diabetes called gestational diabetes. It's different to the normal diabetes that we get from type 1, type 2. You can get anemia, so check the levels of iron, and your thyroid function can be checked as well. We also check blood group, so if we need to, we can give something called the anti-D diagnostic testing. So it produces results that establish whether or not a person has a condition or disorder. Medical conditions can be detected by a range of marker chemicals that could determine that they have the condition, but it's not necessarily part of that condition. So this is the slide that I said you might need for your notes. It asks you about false positive and false negative. So you can see here, if you read this section, I won't read it out for you because that's unnecessary. But if you pause the video, you can read this and fill in your notes. Under the circumstances, when would you carry out further diagnostic tests? So as a result of identifying something in the anomaly scan or the biological tests, or if the person is at high risk of having a fetal abnormality, you can do further tests. So from the routine screening, something could come up. You could be at a high risk category. So very unkindly, women over about 35 are known as geriatric mothers, which is a bit unnecessary. And there could be a family history of a genetic disorder. So people, for example, with Down syndrome could have a baby, and there's a very, very high chance the baby then would have Down syndrome. So tough decisions. Do you or do you not get these biological tests? Some people don't want to know if there's something that is abnormal about the baby in utero. If you have no plans to change your plans based on the results of these tests, then some of them can come with risks. So really, what is the point in checking? So amniocentesis. So amnio, that part of the word comes from the amniotic fluid. So the amniocentesis, needle is injected through. It doesn't look very comfortable. And it goes into the amniotic fluid. Obviously, this is done under ultrasound, so you don't stab the baby with your needle. And it removes some amniotic fluid. The cells floating in this amniotic fluid, which come from the fetus, and you can do what's called a karyotype, where we look at the chromosomes inside the cell and decide whether or not there are the right number, the right shape, the right size, all this kind of stuff. It takes about 2 weeks to get the results back from this. So you can carry this around about the 14 or so to 16 weeks of pregnancy. A useful thing about amniocentesis is that amniocentesis can be, of the two techniques we'll look at, amniocentesis and chorionic villi sampling. Chorionic villi sampling, CVS, can be carried out earlier than amniocentesis, so before the 14-week mark, but amniocentesis has a lower chance of causing distress to the fetus and a potential miscarriage. So there is the possible risk of the infection, and anytime you do something to the uterus and the fetus and the amniotic sac to distress it, you can bring about a miscarriage. Really, there's a lot of stuff to do, especially later on in pregnancy, to rotate a baby that's fairly hands-on and forceful. So it takes quite a lot to actually dislodge a happy fetus, but there's still the risk of miscarriage. So CVS, a sample of placental cells are removed. So this is carried out at 8 weeks, so you can do it earlier. There's a higher rate of miscarriage because going through with a needle, it stimulates it a lot less than actually going up the vaginal canal through the cervix into the uterus and having a look around for cells. High rate of miscarriage, earlier termination is possible. So if you were very against having a child with a chromosomal abnormality or another anomaly, you could find out earlier, and it's a less distressing termination if you do it earlier. So karyotyping can be performed again, and you find out almost immediately if the fetus has an abnormality. So these are just some diagrams showing the biological testing and the karyotyping. So this karyotype is lining up the chromosomes and having a look. So a normal one, you can see 2 copies of 1, 2 copies of 2, etc. This one here, you've got 3 copies of chromosome 3. So that is Down syndrome's karyotype. It's Down's syndrome because it's eponymous after a researcher whose surname is Down. So this is a page you will need for the next fill in the blank box. There's a table in your notes and it asks you to fill in different syndromes and the defect and the effect. So for Down syndrome, it's 3 copies of chromosome 21. Characteristic learning difficulties, you can get fetal heart defects, hearing defects, minor intellectual deficits to larger intellectual deficits. It occurs in somewhere between 1 and 800 live births. If you sum up all of the different eponymous chromosomal abnormalities and how likely they are to occur, everyone in the entire population should have one. That's basically, if you sum all of these 1Ns, everyone should have something. So Turner syndrome is XO, so you have an X chromosome, you are phenotypically, so in appearance-wise, female. But since the ovaries don't develop, you tend to be infertile and fail to develop secondary sexual characteristics. So that would be the breasts, pubic hair, changes to hips, changes to other parts of the body. Interestingly, you can be a mosaic for some of these conditions, which is very interesting. So you can have some of the phenotypic traits of things like Turner's, but not all of them. We have Klinefelter's, which is XXY. So a higher proportion of men in prison have Klinefelter's than is in the general population. Klinefelter's can make you more aggressive. The phenotype for Klinefelter's tends to be male. However, you tend to be infertile because your testes are very small and they don't produce very good sperm. In Edwards, which is trisomy 18, you see a lot of these are trisomies. That's due to something called a non-disjunction in meiosis, which you don't need to know about. 3 copies of chromosome 18, 1 in 3,000 live births, characteristic change to the skull shape, small chin accompanied by heart and kidney defects. Many sufferers survive beyond very few survive beyond the first year, and all show a profound delay in aspects of development. So, just a little quiz. What is antenatal screening looking for? What is it used for? Describe the differences between dating and anomaly scans. Give an advantage and a disadvantage of CVS over amniocentesis. Okay, so antenatal screening identifies the chance of a fetus inheriting a disorder. Describe the difference between dating and anomaly scans. Dating determines the stage of pregnancy and the due date, whereas anomaly is looking for a serious physical abnormality. And advantages and disadvantages of CVS over amnio can be carried out earlier, CVS can, but there's a higher rate of miscarriage. We will look in the next section at just a little bit extra on what you did in National 5 with Punnett squares. It's actually very, very interesting and very, very easy once you get your head around it. So hopefully we will greatly enjoy that section. If you've got any questions, please do ask, and I hope to see you in the lessons.